I'm Michelle Fleming, and my project today is titled A Teaspoon of Faith Helps the Still-Beating Turtle Heart Go Down, Medical Pluralism and Various Christianities in Piste, Yucatan. Yeah, you like that. So, this project was conceptualized as a qualitative study of families' pluralist decisions about medical care, their general knowledge of health, and their religious beliefs. It considered mothers' knowledge and practices of two basic kinds of medicine available to them here, biomedicine and herbal medicine. It specifically investigates how they selectively use elements of these two in relationship to their religious liberation and resources and traditions in their cultural context, meaning their family backgrounds and mainly their family backgrounds. This rural Mexican community is undergoing mixed economic development as a result of the increased tourist traffic to the World Heritage Site of Yucatan. So I lived here in Piste with a family, and my family was a big inspiration to me choosing this topic. I came into this knowing that I wanted to study medical anthropology, and then...
Are we recording?
Yes.
Did you recording?
Okay. My baby sister got sick, and she was vomiting and had diarrhea. She went to the doctor, and it didn't work. So their neighbor that comes and washes their laundry and is the daughter of a traditional healer or curandero, she came in and said, that baby has ojo de borracho. And they treated this illness, which is when a drunk person looks at your baby and it's conferred into the child and becomes sick from it. They treated it with a bath, and then she was healed. And they really believed that worked. And of course it did. She stopped having the symptoms. It worked. So I just came up with all of these questions. How did they use both the doctor's advice and the bath with no conflicts of consensual interest? Why did the first treatment fail and the second treatment succeed? How are these two balanced? There are a lot of religious or superstitious undertones in the story because of the person looks at the baby. There is kind of a superstitious feel to the way that it's getting from the person into the baby. So I wanted to look at the different religions and see if it was different between Catholicism and Protestantism. So this helped me form my research problem, namely how do mothers in Piste make decisions about health of their families using medical pluralism, and this is different in different countries. So the first thing I'm going to talk about today is how I planned to go about this and then what actually happened. So I knew in advance that participant observation and seeing different treatments or going about different treatments would not be possible unless I got myself sick and then asked people to fix me. I wasn't really willing to go that far for anthropology. So I planned interviews instead, which would be shorter, condensed versions, but hopefully still valid information. I started collecting people through my homestay mother and then through snowball sampling and then following other participants. So I planned originally that I would have 3 mothers of each type of Christian religion here in Piste, Catholic and Protestant. And then, I don't want to say that religion is dichotomous here. There are many different kinds of Protestant religion. In my study I looked at Presbyterians, Evangelicals, and Jehovah's Witnesses. And there are others, but it just appears to me, especially because of the family that I live with who is very Catholic, that most of Piste is overwhelmingly Catholic. So I didn't feel too terribly bad putting the weight of my design on Catholic versus people who aren't. So I also planned 3 focus group interviews, and then this was supposed to provide me easier access to different perspectives on stigmas or controversial opinions, so I knew which kinds of methods to choose. And then I came up with questions of 5 general categories to ask in my interviews, which are, what are the general descriptions of the size and character of the families? What kinds of illnesses and treatments are prevalent? How is nutrition and exercise implemented? Is religion a factor? And what are the mother's ideas of traditional medicine is heritage. Do they see it this way? Are they Maya? So these questions meant really to get at the ideas of the background of the family, general knowledge, religion, and the validity of traditional medicine as heritage. So I wrote out questions in English, then translated them into Spanish, and I had a page of questions. And I thought originally that I would ask the same questions to every person. I also included things about using different services, different kinds of doctors, birth control, which is one of the only religious things that's affected by medicine, or medical things that's affected by religion that I believe. What actually happened, I got 8 interviews and a few conversations with 7 families, so 4 different religions I've already listed. I had interviews running the gamut from casual to formal and unstructured to very structured. They're mostly planned for a specific time, but that didn't really work out because people don't remember that ever. Even if you talked to them an hour before and you said, okay, I'll come back in an hour, they forget that you're coming back. So my shortest interview was about 50 minutes and my longest interview was 4.5 hours. I had planned a single focus group, and I had it last night. I haven't actually written it up yet, but I got 3 women in the same place at the same time, and they mostly just talked about what it's like to have a baby. So I'm not really sure that I can use that information for my results. But these questions that I used, I really only got to use them directly in a couple of my interviews. The rest of them, I just kind of went back to my basic categories and looked around in those different areas. I had a general inability to interview mothers about their spouses in most situations. I was not expecting the dads to be around and wanting to talk about this kind of thing, and that was a presupposition that I should not have made. I'll talk about that a little more later in my successes and failures section. So, my interviews went pretty well. I think that the language barrier issue did not prevent me from understanding what they were trying to tell me, or them understanding my questions. I have my data, and I have the summary of it written here. I had a very difficult time kind of trying to sort it out or categorize it, almost as if I'm looking at a large painting of many complicated things at once. And I can't figure out which thing, I can see it all, but I can't figure out how I'm supposed to start talking about it. So this is one of my main problems in writing out what I've collected. The families I've talked to are of different sizes, ages, socioeconomic positions. All of the informants said that they used doctors and medicines from the pharmacy when they were sick. There's a public clinic in Piste called the Centro de Salud and a private clinic called La Promesa. Valladolid is the next step for more medicine because there isn't always medicine in Piste, and some emergency services, but Mérida is the place to go if you want anything serious done, if you want a specialist, if you want real emergency care. That's over 2 hours away, 4 hours away depending on how you're getting there, so it's super close. Families with, I should qualify this before I talk about it. I end up having to talk about the amount of money available to a family without being able to I draw these conclusions based on their homes and their professions, but I don't really have any other authority to classify them or to describe them in these ways. So this is just my impressions on visiting their homes and seeing what they have and hearing what they're telling me. So people with more money went to Mérida almost always. For example, one informant said that every exam ever given in Piste has been inadequate. The medicine here is not good enough, and she will not tolerate anything less for her children than taking them to Mérida. And then one person lived in Merida for 10 years and goes there because she has young children and nobody in Piste can take care of her kids correctly. So then other people stayed in Piste, went to Valladolid. People tend to self-medicate in general, as in, they keep a giant plastic basket of, oh, you have a fever, take this. Oh, you have a headache, take this. And just the same as, for example, my mom has Advil or whatever. But there are actually people here that refuse to do this or don't do this. The Jehovah's Witness family that I talked to and the Perfecto family that I talked to, or I guess we also call them evangelicals. It's a very small church with a local name. The Perfecto thing is a nickname that they don't really like. But I use it because there's nothing else to call them to differentiate them. Yes, so so these two groups of people claim to never use over-the-counter medications without a doctor's telling them that they should do that. 6 of my informants of the 7 families said that they use a type of herbal medicine, which, and I've kind of separated these out into 3 things, can mean a men, a curandero, or a hierbetero. And it depended on who I spoke to, but most people use the term hierbetero, even though at times I thought they could be talking about a curandero or a hierbetero. But I think we've all here learned what a med is, a religious practitioner, a traditional Christian religion that has the power to cure supernatural illness. And then there's the curandero, who uses herbs to cure either naturally or supernaturally caused illnesses with herbs and or magic. And then there's the hierbetero, who cures natural or supernatural illness with herbs. So most people spoke about herbal medicine as something practiced in their families, aunts, grandmothers, things that they already knew how to make themselves and get fixed, but they didn't really go to professional practitioners that often. Only the Catholic informants expressed belief in supernatural illnesses, except for my Presbyterian informant, whose mother is Catholic. So she believes in Malojo because she was raised that way, and when her kids have something wrong with them, she takes them to her mother and asks her mother what's wrong with the children. She doesn't see those things herself. So the professionals they believe in the use of herbs, but none of the supernatural beliefs. The plants have natural healing powers, but there should be no crystal divination, or there is no Malojo because it doesn't exist. And then the Jehovah's Witnesses do not use any kind of herbal medicine. The beliefs also appear to vary by age. The older the informant, the stronger their belief in the possibility of supernatural illness. I also inquired into the price of care and its effect on their choices. So traditional medicine was cheaper than biomedicine, than Piste, Valladolid, and Merida is most expensive. Because I interviewed a number of historians in Merida, I heard a lot about how much better it is to go to Merida. But in theory, families with less money would choose the option that's generally cheapest, something traditional, or stay in Piste, in theory. But in the case of the family I interviewed with the least money, they don't believe in this type of medicine, so they only went to see the doctor, the free clinic. Herbal remedies were generally either used first quickly, and then they would go to see a medical doctor, and they would go back to a hierbetero possibly if somebody had something very seriously wrong with them that was expensive to fix, such as a surgery. If you're about to get a surgery, you double check with somebody else before you get it done to make sure. So mostly that's pretty much what I've collected. I don't really know how to organize it. I think it was fairly successful. I had a lot of failures, mostly in the fact that my days between 2 mothers didn't work out because
Your what was mothers?
the idea I had that I would speak to moms, to women, didn't really work out because the men were always there, answering the questions most, and in a lot of cases, almost screaming the answers their wives gave, which I think is an entirely different basket of goodies that I personally cannot comment on. But I do not know the reasons.
Yeah, we all know.